The Rotherham Macmillan Benefits Advice Service is delivered by Rotherham Brought Together Welfare Rights and Money Advice Service through a contract between British Telecom and the Rotherham NHS. The service is funded by Macmillan Cancer Support and commenced in June 2009.
I think the beauty of this is that these three partners all working together makes a much wider range of access points. It enables us to see a wider range of people and makes it easier for information to be relayed within the partners working in conjunction with each other.
The service offers people living with cancer who live or receive treatment in Rotherham high quality, free, impartial advice and advocacy about benefit entitlements. This includes advice to patients, their carers and their family members.
We can do home visits, which is usually the most convenient for people. They don't have to leave their own home. We come out, we make arrangements to come and visit them. We see them at home, they've got all their information to hand. And that is usually the easiest solution, and that's the one that people most want.
That was really easy because immediately I started with the negative questions, I can't possibly be eligible for this, and was reassured very quickly that I was actually eligible and that it was a very simple process and the service would support me through that process. I actually didn't have to even go and visit an office. I could do it all from home.
Obviously, as well as having the home visit access, which is really good, which patients appreciate, there's also going to be a session starting on a Thursday morning, which again will add to the benefits. People who want to discuss things immediately, for some from a clinic situation or being aware that that's running, will be very good.
The advice given is not just initial advice and assistance, but also ongoing follow-up and support. As a cancer patient's condition changes and as different treatments are undergone, their benefit entitlements also change.
We have a wide range of information available. We can access information produced specifically by Macmillan, so we can find out information about particular cancer types. We have a wide range of benefits information. So if people just are looking for information at this point and don't want us to act on their behalf, that's fine, we can do that too. We can give people everything they need to know and then they can take their time and think about it. And if they want us to follow up for them and claim benefits, then that's fine, that's easy, we can do that too.
The service gave me lots of other information about things that I was eligible for, support that I could get either now or in the future, and some very good recommendations on how I should approach things like finishing work and early retirement and ill health retirement. So all in all, I've had a very good and positive experience.
The service is provided through home visits, office appointments, telephone advice and hospital-based advice sessions. Access to the service is by referral from any other professional working with the customer or self-referral at a time that suits the client.
I think the easiest way to contact us really would be to seek a referral from the GP, any Macmillan nurse that they may come into contact with or any other health professional, and that enables medical information to be relayed to us and takes the burden off the person having to tell us their diagnosis, what type of cancer they suffer from, because there is quite a lot of information we need to enable us to do a benefits assessment. Benefits advice is unique to each individual, so we need a lot of information about personal circumstances, etc. So the more information we can have beforehand, before we talk to people, it makes it easier.
I think the experience of the service has been that from the point that I made the first phone call, I felt completely supported in the process.
The service provides help with applying for benefits, including the completion of application forms, means-tested benefit calculations, challenging benefits decisions and tribunal representation, accessing Macmillan and other charitable grants, applying for blue badges, bereavement benefits. The Welfare Rights and Money Advice Service holds the Community Legal Service Quality Mark ISO 9001 Quality Management Standard and Customer Service Excellence Accreditation.
I think the beauty of working in partnership with the Rotherham NHS and Macmillan Cancer Support is that there are a wider range of access points and we would like to see all district nurses, GPs, any health professional encouraging their patients to access and seek benefits advice.
Certainly from my point of view, working as a lung cancer nurse specialist here in Rotherham, the service has been excellent for patients where financial issues are a big problem for them. We can access the service directly, either over the telephone, via fax or by email. The response is very quick. But equally for people who don't realise what they're entitled to, we can actually instigate that and follow that up with the home visit from the service. So it's proving very, very beneficial.
So overall, all I can say is that it's been a fantastic experience, and that additional finances enabled us as a family to start to look at maybe for this moment, while I'm still reasonably well, some additional treats which are nice when you know that at some point in the future you're not going to be able to access that sort of activity.